Our faculty are tremendously invested and focused on the medical and surgical development over the 2-year fellowship program. We have tremendous pathology between our TMC campus and our LBJ campus. At the beginning of the fellowship, our fellow starts in the operating room week 1 and is generally in the operating room anywhere from 2 to 4 days a week throughout the 2-year fellowship. This allows the fellow to progress in his or her surgical skills from the very beginning. Our goal really is for our fellow to be essentially an autonomous retina surgeon by the end of year 1, and subsequently year 2 is a year of refinement.
Another aspect of the Retina Fellowship Training Program that is essential is your role in helping us train our residents. So we want the best resident training in the country, we want the best fellowship training in the country, and fellows help train our residents.
I think the fellow can expect on average 4 to 6 cases a week, including scheduled cases and add-ons. For me, I'm expecting to hit somewhere around 300 to 400 primary cases by the end of my fellowship. Most of your cases take place at the county hospital. Lots of really bad, difficult diabetic cases, retinal detachments. We also get quite a bit of trauma experience as well, being one of the busiest trauma centers in the country.
In addition to all this medical and surgical retinal experience, we also have a good exposure to uveitis. Dr. Dahr is a nationally renowned uveitis specialist, and he's a great teacher. And we also have a really good exposure to ROP.
My name is Layla Gagarechi. I am the Chief of Pediatric Ophthalmology. Memorial Hermann NICU is a pretty busy NICU. I screen about 25 babies a week, sometimes less, sometimes a little bit more. And I do, on average, about a treatment a month for these babies. The goals of the experience for the fellow are to make sure that they feel comfortable with the ROP exam on babies, that they feel comfortable with the exam findings and classifying the stages of the disease. Also getting exposure and learning how to perform the various forms of treatment, including injections with anti-VEGF medication and also laser. ROP is important for any retina fellow because it increases their experience and kind of marketability. If you are able to perform ROP exams, you can be a valuable asset to any department.
Our faculty and our department are tremendously invested in our surgical retina program. We have the patients, the facilities, the technology to provide a great 2-year experience. We have the latest Alcon equipment in our operating rooms, including the 20,000 cut rate cutters. We also have 23, 25, and 27 gauge kits. So we're really able to expose our fellow to the full spectrum of instrumentation.
We understand that the learning curve in retinal fellowship can be a bit of a challenging at the beginning. We take a hand-holding approach when they start. We'll make sure that our fellow understand all the details, every surgical maneuver, and get a good grasp on those details and build our confidence quickly. Our goal is to train future retinal specialists who can provide compassionate and excellent care for patients with vitreoretinal conditions.
Even if you were to come from outside UT, I think you'd find all the faculty and residents very pleasant and easy to work with. You'll definitely get opportunities to really showcase your autonomy and independence as you progress through fellowship.
One of the biggest draws for me to UTHealth Houston was the environment of collegiality. At my visit, I noted how well everybody seemed to work together. I felt like they viewed each physician, each trainee as a human being and really sought to help them grow in their career. You're part of the UT system, and so you have access to all different kinds of resources for research. So it's really a place where you can grow and develop your own niche. This is the most important stage of anybody's training, and it shapes how you'll practice for the rest of your careers.
Given the shortage of uveitis specialists around the country, retina specialists will encounter complex uveitis patients on a day-to-day basis. And we think that those diagnostic and therapeutic skills will make our fellow a tremendous asset for practice groups around the country.
So it's our goal to be one of the best departments in the country. And the retina training program is quintessential to achieving our mission. of being a comprehensive training program. And there's a whole lot of opportunity for collaboration. You've got Rice University right next to us. We've got MD Anderson, which is also part of UTHealth down the street. We have collaborative meetings with Baylor. Also, what I like about TMC, we're right next to this giant park called Herman Park with the zoo, with lots of activities. And there's affordable housing, walking distance from the medical center that's safe, nice, with lots of stuff to do around here. So it'll be a good place to live for a couple years.
In summary, our fellow really experiences a very broad and deep array of pathology. We as faculty really want nothing but for our fellow to succeed, and our fellows' education is our primary goal.